Hello, my name is Jocelyn Raude. I'm a full professor of health psychology at the HESP School of Public Health in Rennes, France. I'm going to address in this course the social and behavioral challenge in the control and prevention of mosquito-borne disease. To introduce my topics, I would like to mention an important and famous case in the scientific literature, which could be called the Loveland County paradox. Loveland is a county located in the north in Denver, in Colorado, USA. In this county, there was in the late 90s a very extensive program of vector control, which has been partly successful. As you can see on this graph, the vector index are much lower in Loveland than in Fort Collins, another county adjacent to Loveland, which is located in the north of the state. The difference in the two vector index was extremely important due to the success of the program. Surprisingly, when the scientists look at the data concerning the infection rate by the West Nile virus in the two counties, they just observe that the rate was much lower in Fort Collins than in Loveland, which was surprising because there is much more extensive program in Loveland and fewer mosquitoes in Loveland than in Fort Collins. How to explain this paradox? In a survey conducted by the scientists of the CDC, it appears that the Loveland resident was substantially less likely to report using repellents, like repellents based on DDT, and avoiding outdoor activity during the day. This example illustrates the fact that the transmissions of mosquito-borne disease depend on a large range of factors. The most common factors are, of course, the factor related to mosquito, like the mosquito abundance or density. However, this factor alone is insufficient to explain the transmission or the difference in the incidence of vector-borne disease. Some other factors, for example, the one related to the environment, are also important. As you know, humidity and heat, or the combination of these two factors, are extremely important to explain and understand the proliferation of the mosquitoes. But last but not least, the human factors are also extremely important. For example, human abundance and density are important, as are the housing condition. But the self-protective behavior play a decisive, crucial role in the transmission of the infectious disease. In the ecology and epidemiology of infectious disease, it has been increasingly recognized that the human behavior play a fundamental role in the transmission and emergence of infectious disease. This is true for the vector-borne disease, but also for respiratory infectious disease or even foodborne disease. Spite of the importance of self-protective behavior to limit the spread of the infectious disease in the endemic region, the data shows that people are not likely to use some protective health behavior. For example, even if it's recommended in Reunion Iceland to use coils or long sleeve clothes or mosquito nets, or as you know, to avoid the stagnant water, it has been shown that most respondents in a survey didn't use the repellents recommended by the health authority to reduce the mosquito bites. As you can see here on this figure, only 20% of the people were using regularly some repellents to avoid to be bitten by the mosquito. And 44% of the people never use this kind of health protective behavior to avoid to be bitten by the mosquitoes. Why some people adopt self-protective behavior while some others doesn't? In the social and behavioral science, several factors have been demonstrating to affect health protective behavior. The first type of factor is a factor related to capacity. For example, the knowledge or the skills that the people have to adopt a specific behavior. It's also about the fact that some people have some information about a risk factor available to them. Some people have also some more comprehensive available information, while some people don't have the relevant information they need to adopt this behavior. The absence of health protective behavior could be also related to the motivation that the people have. For example, some people benefit from the social or peer support for adopting some specific behavior. Some people can distrust science or medicine and share alternative belief about the way to protect against mosquito. And sometimes some people who adopt health protective behavior had poor experience of the adoption of this behavior, which incited them to avoid this kind of behavior in the future. Finally, the social and environmental context play a very important role in the adoption of this behavior. For example, some population benefit from health education campaign and program, while some other don't. In some region, the mosquitoes are very affordable and they don't necessarily in other region. And finally, it's an important point, some people benefit from intervention from the public health authority, while some other don't. How to promote self-protective behavior? To develop an effective program of intervention, it's important to consider the fact that we need to consider the need and the circumstances which are specific to some people. There's an existing model for that, which is called the trans-theoretical model. This model implies that some people are in a preterm completion state. That means that they don't receive the proper information, so they are not aware, uninformed, and they have no intention to change or alter the behavior. In some other case, the people are receive the required information and are in the contemplation state. That means that they are aware of the problem and they can consider how to act in the future to avoid to be bitten by mosquito. And in another stage, people need information, or beyond information, they need competency to know how to deal with the mosquitoes. It's what we call the preparation state. And when people have started to act to reduce the mosquito bites, they may have experienced a negative experience of the utilization of health protective tools. The best situation is when people are able to maintain the health protective behavior, but it's only uncommon to obtain such kind of results in a short period of time. The conclusion is education and communication are not enough to implement quick and effective behavioral change. How to promote health protective behavior? The social and behavioral science shows that we have a range of strategy and techniques to implement such change. The first and the most famous one is, of course, education. We can increase knowledge and understanding of the risk by the people. The next one is persuasion. Persuasion refers to the fact that we can induce some positive or negative feeling to stimulate a given action, like the utilization of repellents. We can also offer to the people or provide them some training and guidance. That means that we want to improve the mental and physical capacity of the people to adopt a specific behavior. Another strategy, which is more a population strategy, is to implement some choice architecture. That means that we are going to make the health protective behavior much easier to adopt for the people. Another one is what we call the incentivization. That means that we are going to implement some expectation of reward or from blame from the other people. This incentive can be material or immaterial, like the support we expect from the other. And finally, we can use some coercive or restrictive measure. That means that we can use some rules to increase the opportunity to engage in self-protective behaviors. To remind you the main information I provide you during this course, I have to tell you that human behavior plays a fundamental role in the emergence and transmission of mosquito-borne disease, as many works has demonstrated it until now. However, and surprisingly, the self-protective behavior remains uncommon among population in many endemic regions. So why is it like that? It is because changing health behavior is not an easy task, and providing information, as it's commonly done, is generally not sufficient to trigger health behavior change. However, there exists a variety of interventions that can be used and implemented to promote the adoption of self-protective behavior, and we need to consider the variety of these strategies. If you want to know more about all these means and mechanisms, I encourage you to read these articles, and I thank you for your attention.